Dr. Kevin Mangelson from the Center for Sleep Apnea and TMJ. I wanted to talk real quick about what successful oral appliance therapy is, and how do we determine if oral appliance therapy is A, a good fit for you, and then B, if you've been successful with your oral appliance therapy. Previous videos have shown, and if not, give us a call and we can answer your questions about what oral appliance therapy is. But oral appliance therapy is basically a device that fits over your teeth and keeps your lower jaw from falling back to open the airway. There's a couple ways we look to see if this is successful. First of all, you should be evaluated initially and to determine if you're an appropriate candidate for an oral appliance therapy. Once you've been fit with an oral appliance, we look for a number of things. We start typically in a nice neutral position that should open the airway, and we determine from there if it's effective. We look for you to snore less. We look for you to be sleeping better. One of the biggest keys to the success of oral appliance therapy is appropriate follow-up. Unfortunately, sometimes people are fit with these appliances and then forgotten about. You may have been fit with one, something that you purchased offline or with a provider that kind of gave you an appliance and then didn't do appropriate follow-up and care. I strongly believe that the success of oral appliance therapy is only as successful as the follow-up care. When we fit someone with an oral appliance at the Center for Sleep Apnea and TMJ, we do everything we can to ensure that we have appropriate and routine follow-up. So we follow you up, we speak on a regular basis to find out, are you sleeping better? Are you snoring less? Do you feel more rested? In fact, we slowly move that lower jaw forward until we feel like you've reached a point where the treatment is successful, where you come back to me and say, hey, Dr. Mangelson, I've been using my appliance now for a few months. I'm sleeping better. I'm feeling more rested. My bed partner is reporting no snoring, or I've used some sort of a device to record and I'm not noticing any snoring. And once we reach that level, then it's time for some sort of follow-up study. So what I'm going to do is refer you back to a sleep physician or a board-certified sleep provider who is going to do some sort of follow-up study. Maybe a home test or a test within the hospital to determine how effective this oral appliance is. So you'll spend the night sleeping with either a home test or in the hospital with your oral appliance, and at the end of the night, we're going to get some sort of data or report of how successful your treatment was. We're looking for that treatment to be successful so that you can get your sleep apnea treated and treated well in a way that fits your lifestyle and is comfortable for you. Oral appliances in general are successful when we choose the right patient and we do appropriate care and follow-up to make sure that you're getting the best treatment possible for your sleep apnea. With questions, please reach out to the Center for Sleep Apnea and TMJ or your local provider to find out if oral appliance therapy could be a helpful treatment alternative for you.